2 poultry workers in England have tested positive for bird flu after coming into contact with infected birds on the same farm. This is the first time that human cases of bird flu have been confirmed in the UK since 2016. The workers were exposed to the H5N8 strain of the virus, which is highly contagious among birds but rarely infects humans. The farm, located in North Yorkshire, has been placed under quarantine, and all 10,500 turkeys on the site have been culled to prevent further spread of the disease. The workers are being treated in hospital and are expected to make a full recovery. Health officials have assured the public that there is no risk to food safety or public health from this outbreak. They have also advised people to avoid contact with sick or dead birds and to report any sightings of them to the authorities. Bird flu, also known as avian influenza, is a viral infection that can affect different types of birds, such as chickens, ducks, and geese. It can sometimes jump to humans who have close contact with infected birds or their droppings. Most human cases of bird flu are mild and cause flu-like symptoms, such as fever, cough, and sore throat. However, some strains of the virus can be more severe and cause serious complications, such as pneumonia and organ failure. The World Health Organization, who monitors the global situation of bird flu and provides guidance on how to prevent and control outbreaks. According to the WHO, there have been 862 confirmed human cases of bird flu worldwide since 2003, resulting in 455 deaths. This is the first case of bird flu in humans in the UK since 2022, when one person was confirmed to have the virus after coming into contact with infected poultry. The person, who lived in the southwest of England, was asymptomatic and had been exposed to a large number of infected birds in and around their home. The virus they caught was the H5 type that is found in birds, but it was not clear whether it was the same H5N1 strain that had been causing outbreaks in poultry across the country. This was the first time that H5 had been detected in a human in the UK, although there had been cases elsewhere globally. The UK Health Security Agency said that there was no evidence of onward spread and that all close contacts of the person were being monitored. The risk to the public was very low, as human-to-human transmission of bird flu is very rare and requires close, prolonged contact. However, bird flu poses a serious threat to animal health and welfare, as well as to the poultry industry. Since October 2021, there have been 284 cases of highly pathogenic avian influenza, HPI, H5N1 in England, leading to the culling of millions of birds. The UK is currently in an avian influenza prevention zone, AIPZ, which means that all bird keepers must follow strict biosecurity measures to prevent bird flu and stop it spreading. The UK Health Security Agency said there were no signs of person-to-person transmission of the virus, which has spread dramatically in wild bird populations and affected other species. This statement came after the agency detected bird flu in 2 poultry workers who had recently worked on an infected farm in England. The workers did not show any symptoms of the disease and tested negative after the initial positive result. The agency said it was likely that they had inhaled the virus from the contaminated environment on the farm, rather than being truly infected. Bird flu is a seasonal occurrence in the UK, as some wild migratory birds bring the virus with them during winter. The disease can then spread to populations in farms and wildlife sanctuaries when wild birds mix with captive ones. This season, the first outbreak in a captive population was near Wychavon in Worcestershire, England on October 27. Since then, more than 500,000 birds have been culled across the UK to contain the spread of the virus. The UKHSA said it was monitoring people who had been exposed to infected birds to learn more about the risk of transmission. It also advised people to avoid touching sick or dead birds and to report any sightings to DEFRA. The agency said the level of risk to human health remained very low, and there was no evidence of this strain spreading from person to person globally.